Medical Dilemma.
Welcome back to Medical Dilemma. Before we start our discussion for the second segment, I just would like to mention our major sponsors, Makati Medical Center, St. Clair's Medical Center in Palanan, Makati, LifeQuest Training and Consultancy Corporation, and its partner, Manila Workshops. Now, for the second segment, I'd like to start off with our co-host, okay, Attorney Sara Sugitan from the Sugitan Law Office.
Hi, Sunny.
Hello. And Dr. Teresita Sanchez, our medical legal consultant for the show.
Hi, hello.
Yes. Now, as I was saying, the topic for the second segment, I guess since we're talking about teenage pregnancy and the risks that come with it, there must be some use for contraceptives in countering such risks. Dr. Sanchez, what do you think of the role of contraceptives in teenage pregnancy?
Well, as an OB-gynecologist, there are patients who come to me, especially some minors, no, and they come with or without their parents, sometimes with their boyfriend. But you think of this, you think of it probably as a lesser evil. If you know that they're determined to stay together, no, even with the benefit, without the benefit of marriage, then you should try to assist that, because as said earlier by Dr. Ifurum Gonzalez, that sometimes there is a very high risk in early pregnancy. So in teens, in those who have not yet fully developed yet, there's that high risk. They may even lose their lives. No? So you think of a lesser evil.
So when you say the lesser evil, Dr. Ifurum, I suppose the use of the contraceptives will follow after the first pregnancy.
Yes.
Yes, and so what complications are prevented after the first delivery?
Actually, not only after pregnancy, but even if the patient has not had any pregnancy yet, if the patient is not willing to get pregnant, but you really cannot hold, but they have sexual contact, unless they really celibate now, no sexual contact. But the reason why doctor said that it's lesser evil is it's better not to it's better to take contraceptive pills rather than getting pregnant wherein you are not yet ready to have.
At a very young age. Okay. But isn't it that when you advise a teenager who is not yet of legal age to use contraceptives, the parents also have to be informed?
In my case, I don't necessarily inform the parent because usually the one that comes to me is the teenager and the boyfriend. And I would just, during their consultation, I would tell them the advantages and the disadvantages of taking the pills.
Actually, these days,
Yes,
even here, we recognize what we call matured minors. That's
Matured
usually
minors,
from
yes.
the age of 15 to 17, because they're matured enough to know what they want, no? And well, if it's just contraception, it's not really necessary, I suppose, to inform the parents unless they get pregnant, because ang danger nun, baka there are complications attributed to pregnancy per se. And sometimes if something happens to the teenager, she dies, for example, because of a complication of pregnancy, then you're left holding the bag, no? The OB gynecology might even be sued for that. That's why
I
you have
see.
to inform parents.
Okay.
Oh,
Attorney
maganda
Sara,
yung,
yes.
yeah, when our doctors here in the show say that contraceptive is a lesser evil to unwanted pregnancy, a corollary to that is when you do not want to have the baby, many of our kababayans resort to abortion. Let's face it, it's like I think a lot of people, I don't have the statistics, no, and I think it's very common because we are a very conservative country. And ang popular nga dyan you don't just go to the doctor, you would take something to abort the baby. Yung ano ba,
You go to Quiapo and
abortifacient.
buy
In
an
Quiapo,
abortifacient.
it's very popular for that. Allegedly, yung mga herbal ways sort of to abort the baby, and it can be very unsafe, sabi nga nila, especially kasi pregnancy is of course a health issue. Your body's going through changes, and whether or not you're a teenager or even you're no longer a teenager, you're capable of bearing children, if you do not want to have the baby, of course hindi kasalanan ng bata yon. Child did not ask to be born. However, the implications of that, the unwanted parenthood even, it's something that, well, everybody has to bear. If you're pregnant and you did it, and kasi yung question niya lang kanina, do you need to inform your parents? Kung halimbawa, teenager couple wants to have sexual intercourse, does the parent need to come in? Do we need the consent of the parent? Not necessarily, and as doctor said, that's confidential. No?
And it might discourage the teenager to consult properly the physician, the obstetrician gynecologist, because ay naku, susumbong to sa parents ko, and they don't want that. So rather than go to, for example, sino yung mga fake doctors or whatever, you might as well treat them properly.
Kasi sa probinsya, doctor, ang popular yung mga hilot. For
Yeah,
example. So
yung-
I'm not sure kung they're doctors, maybe they're not, maybe ewan ko kung illegal practice
They're
of
helots.
profession. But
They're really helots.
Yes, and that's part of it, yung pagpang-abort. Kasi nga, especially in the provinces, I don't know about the city, baka hindi pa acceptable or there's a scandal. So, yung ganun, it's a scandalous circumstance. So,
Definitely it's not acceptable because we have our law, and definitely abortion is considered to be a crime. That's why, but very few people report because it penalizes all the parties involved, which
That's true.
include the patient herself.
Yes.
So, sino magsusumbong dyan? Madadali rin ako. And if the parents are around, they will also be involved and criminally
yes,
liable.
under the law, there's such a thing as unintentional abortion.
Yes.
Meaning, halimbawa, hindi mo alam, pregnant, tapos nasuntok
Spontaneous
mo.
abortion.
Oh, yan.
Oo, ganun,
That's
natapilok
still-
mo. And
that's
then,
penalized.
yun, so that's criminal.
There's a penalty for that.
Yes, that's criminal.
Then-
If the parents perform it or consented to it, or if the mother consents to it, lahat sila makukulong. Kaya nga sabi ni Doktora,
May
yung civil
civil liability
yes,
and
civil
criminal
and
even.
criminal liability. So,
So
you have
no
a
matter
situation.
who initiates the abortion,
Abortion is
it's
illegal.
a criminal
Yes.
liability.
That's why probably it's underreported. No? Nobody wants to report because baka madali sila.
Yeah, but the consequence of that is not to do it, I mean, to resort to yung, ang sasabi ko nga kanina, Doktore, abortive patients. Oo, yun. So, maraming dangers yun, nagiging medical issue talaga kasi unsafe yun eh. Unsafe
It
yun.
might lead. Does it always lead to a complete abortion, Doctora?
Not
or?
necessarily.
Uh-uh.
No.
So what happens?
Sometimes if the patient undergoes, we call that induced abortion.
Induced abortion.
Meaning to say they either took abortive patient or probably they went to the traditional hilot. Most
Or
of the
they-
time they have incomplete abortion. So that's when what we meant by that is that the fetus has died, but some of the products of conception is left inside the uterus, and so for the patient to be saved, because she might go into profuse bleeding, so the patient should undergo dilatation and curettage, completion curettage. We have to evacuate the products of conception that is left there, or else the patient will die because of profuse bleeding or some of the complications like infection, yeah, and death.
Kasi yung iba, nababalitaan ko, Doktora, like those who consult with me, especially OFW, sometimes they do not want the pregnancy. Not necessarily teenager na to.
Yes.
These are people who are already working abroad
Mature
of legal
mothers.
age. Yes, oo. And they don't want, they didn't mean to be pregnant by someone na they don't have a relationship with or they had casual sex with. Pero pag didinig ako, hanger daw. Yung grabe. So talagang,
Yeah,
I
they
mean,
do anything.
these are,
yeah.
yeah, so they
Instrumentation,
resort.
and that is
Oo.
usually septic. Because
septic na,
hindi mo alam yung hunger, hindi naman i-sterilize mo na yan before doing
The-
anything. Yes.
The environment.
But how
where
come
it's
they
done.
go to you as a lawyer?
Minsan after the fact. So they
After
tell
the
me,
fact.
after
Maybe
the
they
fact,
feel
they've
guilty
already,
also, no?
yeah, oo, they feel guilty about it. And minsan kasi sabi nga ni doktor, minsan incomplete yung abortion. So minsan natutuloy yung bata, then the baby comes out not normal.
Sometimes may defect.
May
ano,
defect,
oo.
etc.
Especially if they took some oral medications that
may
are
effect sa bata.
oo,
eh.
So
sometimes.
what happens? You mentioned that it's a criminal liability. So what happens if a woman gets an incomplete abortion and then has complications and now runs to a medical facility? How should the patient now be treated?
We have to treat really the patient, because if not, the complications will come in, and then that could mean death. So we have to, first, if the patient, I'm sure that is probably a septic abortion, so we have to give them IV fluids, antibiotics, and complete the abortion. We have to evacuate the products of conception.
But
Okay.
not all obstetrician gynecologists do that, no. So there are some who refuse to do it, no. However, in one Catholic institution that I'm familiar with, we have to finish or complete the abortion because it is life-saving. After that, well, we give counseling and
Okay.
advise them that they cannot do it again. Otherwise, we will really report to the authorities.
But you are not obligated to report this particular instance.
Well, under the law, well, I guess not really in this particular
really.
instance yet, no? But you have to discourage because it is bad practice. Even the abortion per se can lead to death of the patient.
Okay. So the law is, silent, or is there anything or nothing in the law that governs reporting an abortion?
No, there is
Case?
there is no mandate on anyone to report the abortion.
No mandate.
There is no.
It's like any ordinary crime, right?
obligation.
You saw somebody kill another, you're not really obliged to report.
You're not
You
obliged
don't want
to
to get
report.
involved, no?
Merong violence against women that leads to unintentional abortion. Minsan kasi, I would
Ayun,
think they don't know that the
unintentional.
woman is pregnant, for example,
Yeah.
and there has been a case of abuse, and then duduguin. Minsan kasi, I'm appalled by the lack of knowledge of many of our kababayans when it comes to, of course, their bodies and sexual relations, the consequences, and as well as pregnancy. Minsan di nila alam eh. They just think they missed their period.
Yeah, they
Diba?
did.
Pero actually, that's already a sign that something's happening in your body. Di po ba, Doktora?
That's why contraception, I think, should be
It's a
there,
lesser
no?
evil.
Yeah, it is a lesser evil.
So contraception is a necessity because of those risks and
At least
complications.
prevention.
Well,
For
Sir,
prevention.
For prevention of
Pregnancy.
Pregnancy.
I see.
not for killing the baby.
Not for
Just
killing
prevention,
the
yeah.
baby. Okay. It's just for prevention of complications and risks.
If I remember, we have this RH bill before, which is now a law, no? Well, there were, like, I remember, Father really worked very hard against it, no? Father Malangit, who, by the
Yes.
way, is not
Not
present
here.
today because on leave, right?
Okay.
And really, there is such a thing as a conscientious objection. In other words, if you, as a practitioner, you're a Catholic, die-hard Catholic, and you feel that you should not be prescribing contraceptives or doing other things that are related to
So
that.
you're not
no?
obliged to.
You're not obliged. But the law says now that you have to report to the DOH and tell them that you are a conscientious objector.
Okay,
In like
so-
manner, I remember we had a past talk before about this, the
Sorry, Doctor,
removing of
before
the
we
plug.
we move on.
Sorry.
It's time for another commercial break. Don't leave the channel. We'll be right back after a few words from our sponsors.
Many of our products were designed to be used in industrial and medical economy.
what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Imagine when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?